Welcome to another segment of Politics Done Right. I'm here with the one and only Kandice Webber, nurse, first responder, Black Lives Matter leader, community activist extraordinaire, everything all in one. And you know what? She's from Houston, folks, but she's not in Houston. Kandice Webber, welcome aboard Politics Done Right. How are you doing today?
I'm good. I'm good.
Now,
Thank you.
Kandice, first of all, where are you?
I'm in Philly, West Philadelphia.
You're in West Philadelphia.
Yeah. I came out to Pennsylvania to fight COVID. Frontline work. Right. So I'm a critical care nurse. That's what I do.
Now tell me, first of all, I don't want to say you're nice and easy here in Houston, because we know even when you're in Houston, you're doing a hell of a lot of stuff, not only nursing, but you're really trying to keep the troops together. Why did you go to Pennsylvania?
Well, so I put a little bit of science to it. You know, when you look at the areas that are hit the hardest, and the times, peaks, and, you know, all that, I'm trying very hard to maximize lending my skills to fighting this pandemic. So the way I figure, by the time things start to cool off more in this part of Pennsylvania, unfortunately, they will be raging in our home state. So I'll come home and I'll continue to do what I do.
No, I want to say that is magnanimous. I mean, we need to have people that really, I mean, the truth of the matter is we have a lot of people that talk. We have a lot of people that do a whole lot of stuff, but the real heroes in this entire game are, you know, the people that's doing what you're doing. You guys are the real heroes. That's not a gratuitous compliment or anything. That's just a statement of fact.
I want to be honest with you, though. I don't want to be a hero. You know, I think that, you know, to hear, you know, I mean, there's billboards everywhere, right? You know, thank you, you know, frontline workers, thank you, healthcare heroes, and, you know, all that. I don't want to be a hero. You know, I'm doing this because, you know, life is precious. And you know, you hear about it, you know, in school, you know, like at one point or another, you may be, you know, asked to risk your life to render aid, you know, to a complete stranger. Here we are doing that, you know. Well, I signed on for that, but, you know, there is some just blatant ignorance that's happening in our country right now. I don't want to be a hero. I want people to do what is necessary for us, you know, to stop the spread of coronavirus. I mean, like, we're busting our butts on the front line. We're tired, you know, help us out here.
Well,
stay home.
You know, you're so right. One of the reasons I wanted to talk to you, I spoke to a doctor last week. I wanted to speak to you this week because I understand where you said, oh, well, I don't want to be a hero. I just want things to get done. But things can't get done unless people really know what you are doing, what you're up against. And the truth of the matter is, COVID to a whole lot of people is an abstraction.
Right.
Complete abstraction to a whole lot of people. And the reason it's that way is, including our governments, they're trying to keep a whole lot of this hidden so they can do what? Open back up the country. I did some blogs this morning about how the misinformation that's going out there. You are our only conduit into telling people what's out there. So my question to you is, what exactly are you seeing? Whom are you seeing being affected? And how do we tackle this misinformation?
Right. So first of all, I want to preface this with, I am a critical care nurse. So the patients that I get most often are the ones that have failed less acute treatments. I get the really sick ones. What I'm seeing is death. So people are dying. And, you know, it's like system by system, body system by body systems just shutting down. Starts with the respiratory system, you know, well, okay, we'll breathe for you. We'll put you on a vent. and then the kidney starts shutting down. Okay, well, we'll put you on dialysis, and then it just goes downhill from there. People are dying, and unfortunately, I can definitely see the disparities, the health disparities with coronavirus. And the saddest part about it is these are the people that are not making choices that end up in my ICU. They're not making choices. They're not out going around without a mask and all of that. They're regular people working essential jobs. Be grateful for the cashier at Walmart. These are the people that I'm seeing that are getting sick, and so or the worst, right? And unfortunately, these are also the exact same people that lack access to healthcare. They are underinsured, not by any fault of their own, but realistically, let's talk about Walmart. If you work at Walmart, you're the cashier at Walmart, they will work you 31 hours a week. Is at 32, you're eligible for some benefits, right? And this is the truth. This is real stuff. Google this shit. Excuse my language, but in times like these, don't believe just anybody on face value, including me. Do your own research. These are the people that are getting sick. They're the disparities. It's like shining a spotlight on them. And it's sad. It's really sad. These are the people that are most affected by the economy, since we're talking about, open the economy, open the economy. These are the people that want to go to work. They need to go to work because they're renters, and rent is due. No matter, what pandemic is going on, rent is due, okay? So they're renters, or they've got, drug costs because they are underinsured, right? They've got redlining that they're dealing with that's, already, creates other disparities, so it's like one thing stacked on another, stacked on another. Any of these one things would be enough for you to suffer some sort of injury, but to have all of them culminate at once, yeah, that'll take you out. So
you know what is interesting, Kandice, from what you're just saying, there is I don't remember who it is I saw on the internet today that spoke about, we're talking about reopening the economy, but the economy was never really closed. A lot of those
right.
people that you're servicing right now, a lot of those people that you're seeing dying right now are the ones who are considered essential, and they're the ones at Walmart, they're the ones at all these other service places. Mm-hmm. And the people that are complaining, and this kind of really grabbed me, that the people that are complaining because there are other people out there that's not working to serve them. They can stay home and work, but they can't get their hair done. They can stay home and work, but they can get served.
Right. That's capitalism for you, right? Capitalism is a very selfish driving force. Me. I need my nails done. I need my hair cut. I need to get out of the house during this quarantine. So I'm just going to stroll around Target, take a look-see. These are the people that are getting hit the worst. Because you want a haircut? I don't understand it. Nurses, respiratory therapists are dying.
Mm-hmm.
Let's not forget about those respiratory therapists. They're the ones right there with me, up there with that vent, okay, dying here in the United States. Healthcare workers are dying, rendering aid. Right. We're the essential workers, and it's hitting us the worst. And so when we talk about essential worker, everybody talks about the nurse, right? We don't hear very much about the respiratory therapist. We should. Everybody talks about the doctors and all of that. I need us to remember the cashiers. I need us to remember the people that work at the drugstore, the pharmacists, the out of hospital pharmacists, right? People that work in fast food, people that work in restaurants and things, like takeout, delivery. These people are still willing to get out and go and cook you something to eat. So you just have to dine in. That's so selfish, and that's the ills of capitalism.
Now, here is a political thing now. And first of all, I know you're seeing a lot of death. How are you doing mentally? How are you coping?
Right now I'm in go mode.
Mm-hmm.
Like get the work done. There have been some things that I've seen that have kind of like stung a bit. There was a nurse that passed away on the unit that I was working, and she died 2 hours before my shift started. And I walked in on the unit and it was just like quiet, and everybody was like really upset. You could feel it, and I heard that nurse had died, and she died because she was on the front line. That gave me some serious pause. But I mean, you just got to keep going, right? I'm a fighter.
Mm-hmm.
You know that about me. So.
Absolutely. No, I mean, and that is the thing. I mean, when I heard that you were heading off to the Northeast, it was like, yeah, first of all, it didn't surprise me. Okay, it didn't surprise me at all.
Done that a couple times.
But then again, with how things are really, with the semblance of things getting better, but we know what's happening in Texas and all these places. I wanted to talk to you to see some thoughts that you had. Now, Texas is a state that has the highest number of uninsured people.
Yes.
We have some of the worst testing in the country, and now we're seeing that. We are finding more people with that's being hit by this pandemic. Yes. What do you expect when you get back here?
I expect Texas to. Texas is probably going to end up one of the states that gets hit the hardest throughout this, because the demographic of believers versus non-believers weighs heavy on the non-believer side. We've got some relatively healthy people that are going to be asymptomatic. This, like, just flat out, I'm going to call it like it is. Like we have to call a thing right now. It is important to be very blunt, be very honest. Texas is a racist. It is a Republican driven state that thrives on continuing the disparities of Black and non-Black people of color. It always has looked like that. If you want to know how a state loves its people of color, you look at their education. Right now, we're like in the 40th, right? So Texas is not a friend of non-white people. So Black people are most likely in essential positions. We're service oriented, right? And people of color, whether even on the higher scale, we've got, doctors, nurses, and all that. I mean, because we're great, we're brilliant,
right.
But they're very service oriented for Black and non-Black people of color. We already talked about essential workers. That's us, And the sad thing about it is, people can just walk into these places with no mask whatsoever and not be called on it. I'm waiting for the news, to show the essential worker that refused to wait on somebody, take care of somebody that's not wearing a mask. Texas is going to get slammed.
What's my concern about that, though, Kandice? And tell me if it's possible, because my concern is that I think Texas, as like you do, is going to get slammed. But I think that our structures, given how they're controlled, they're likely to hide the real numbers. Tell me if that is even possible.
I think yes, it's absolutely possible. Death, counting mortality. In any state, just the way it's done here in the United States, counting mortality comes down to what the nurses and doctors label as cause of death, right? So if doctors are not labeling COVID-19 as cause of death, even if they label something like pneumonia or, respiratory failure or, MI, because it's secondary to respiratory failure.
Right.
Because they've got COVID-19. If you're not labeling it that way, then it's not going to be counted that way as far as mortality goes. And then you've got other things, like Black people are not always believed. Most often they're not believed when they go into emergency rooms and they talk about the symptoms that they are having. Those symptoms are very often minimized. And I'm talking about I'm frontline to this. I've been a nurse for going on 2 decades. This is not what I've seen just because of coronavirus. It is what it is. It has been this way. Black people are not believed. Brown people are not believed. Latinx people going into the ER. I have seen people that have gone into the ER reading their history 3-4 times in 7 days. And on that 5th day, they are in complete renal failure. This is the stuff that I see every day, right? So we're not believed. These people are going to show up at the ER. They're going to get turned away. They're going to go home and they die in their homes. Do they get counted as COVID-19 or do they not? They just saw this happen in New York.
Right.
So yeah, just by the nature of this disease, counting is going to be skewed. But then when we've got a governor that thinks in line with Trump, less testing, less positive, we're in trouble.
This is the first time I've seen you being so gracious and nice. You said that that Black people and Latinos, Latinx people are not believed. I think it's a bit worse than that. I think folks simply just don't care. And that's why I said I think you're the most gracious in stating it that way. Now, Kandice, let's get a little bit political here.
Sure.
I think there's a paradigm shift that all of us who consider ourselves activists have to be working for right now.
Mm-hmm.
If we allow, in my humble opinion, the same structures to exist when we get out of this, what will be a depression, I think it's on us.
Yeah.
I think it's so important for us to get that unity. I know you work with Black Lives Matter, and I know you work with other groups as well. I think we also have to work with a lot of underrepresented white folk, and you tell me how we do this, to form some sort of coalition to make sure that what we get going forward is not what we've had. Meaning, we need to tear loose on this private healthcare system and really take one that covers absolutely everybody.
So first of all, I'm going to tell you, just like flat out, what is going to make poor white people realize that they're not faring any better than poor Black people? I don't know.
Mm-hmm. Well, you do know, Kandice, and you do know, Kandice, you do know.
Well, yeah. I mean, a lot of white people feel like they're doing okay as long as they're doing better than Black people.
Okay, there you go.
We know that shit's the real thing,
okay,
right? That's the real thing. And that's sad because, damn, that's setting the bar real low for yourself, because we're out here struggling. We are struggling, but, go off, whatever. So, yeah, I think that, like, white people need to work on white people, right? So if you're my ally, I can talk to you about what's going on. If you're a real ally, we will open up our private spaces so you can see it. And then you go work on your own people. I don't want to hear you complaining about your grandpa on or your uncle, whoever the hell it is on July 4th, because he's so racist. Like, I come in contact with that racist uncle of yours, your racist grandpa, every single day, random. No warning whatsoever. Like, nobody, I don't wake up in the morning and just get like, get a text message, you're going to see Rachel's racist grandpa at the grocery store. That doesn't happen for us. So I really think that right now allies need to step up. I think that me as an advocate, I hate to use the word activist because, like, I don't know, that's like some big shoes. But
You are.
thank you. I think I need to be open, right, to teaching, be more open to teaching allies. What's going on, where the disparities are, where her people, his people are getting it good. Even if it's bad for you, understand that it's worse for us. And if we can work together to elevate Black and non-Black people of color, White people don't have a damn choice but to rise. They're already standing on our shoulders, Be you poor or not, you have opportunities because of the color of your skin. And that's what white people need to own. And then, so one of my dear friends, her name is Ann. She's an ally, and we talk about this kind of stuff all the time. And she's done some amazing things. And one night, I was like, Ann, I really appreciate you being the ally that you are. And she looked at me with like the warmest look, and she said, Kandice, I am trying to save my own humanity. I am trying to
She
save
said
the
that.
humanity of white people. I want white kids to look back at the way we've behaved and be proud of us, not be scared, not be ashamed and embarrassed. I'm trying to save our own humanity. I was like, girl, this is why I love you.
Kandice, I'm going to tell you something. I have been running across a whole lot of that. That is part of where I came up with my song, When We Unite the Ghettos, the Barrios, and Appalachia. That is a stereotype, I understand that.
Yeah.
When we can really start doing that kind of work together, which means everybody has to centralize. But when we can start doing that work, that is how we're going to win this battle. And my thing is, Kandice, is that we have to get this done. This is going to be a depression that we're hitting, Kandice.
Oh yeah, it's going to be ugly. I think that so the wannabe revolutionist in me says, I think that people are going to revolt and rise up. Like, this is going to really strip us down to the bare bones. And you can't keep making billions of dollars while I go hungry. That shit just can't keep going.
Kandice, and that's the magic. And you're first of all, you're absolutely right. And my thing is, how is this stuff going to go down? And what I think folks like you have to do, that ally that you spoke to that said that, she has a lot of work to do, because the first part of this thing that's going to go down is before we get a chance to look at the real problem, the plutocracy, they're going to start putting all these wedges in between, not only between Black, white, Latino, and all that kind of stuff, but between have some, have a little bit more, right, and the have nots.
Well, and so here's the thing, though. That's already happening right now, my friend. Right? Like, this is chess, right? They have been lining up their pieces. America has always been this way. This is not new.
True.
Right? Donald Trump is like, I hate to say it, but Donald Trump is the substance of things hoped for in a white supremacist world.
Wow.
Okay.
Wow. Did you just come up with that one?
Well, that's the Bible. But yeah. I love Jesus, but I drink a little. That is also not mine. But that's the truth, though. I mean, I can't think of it any other way.
Right.
America has always been this way. And America is not ever going to change. There is never going to be any balance whatsoever until we take it, because right now, white men are in power. They've always been in power. And even when it's really bad, really, really bad, Bezos has still got a private island and a yacht to get there. Okay. You know what I'm saying? Like, when it's really, really bad, when I am done. I ate my last ramen noodles.
Yeah,
right?
We just made $30 billion on our pain.
That's what I'm talking about. You can't keep doing that, and we keep going hungry. At some point, we have to rise up. So I'm in, right?
We are in, Kandice,
We're
and
in.
I wanted to talk to you so badly. I knew you were out there in the Northeast, and I said, you know, one of our own is doing important stuff out there. I'm sorry for all the pain that you're seeing, but know that you have the folks right back home that you can always depend on. So, Kandice Webber, nurse, first responder, Black Lives Matter leader, community activist, a damn good friend, and somebody I've always been proud of. Thank you so kindly for being a part of Politics Done Right.
Yes, thank you for having me.
I'm Egberto Willies, host of Politics Done Right, an independent news program. I post several news videos of interest every day. I ask you so kindly to subscribe to my channel, and please leave me some comments. Thank you very much.